This is All India Radio. Meera Satpathy is a selfless humanitarian working in the area of public health with special focus on maternal and child health. Kiran Mishra speaks to her. Meera ji, you have been working in the field of nutrition and health with women, with girls, and particularly with adolescents. And your work has assumed a different meaning and dimension since last year when the pandemic broke out globally. You've been going to the slums and educating them about COVID appropriate behavior as well and trying to enlighten them about the benefits of the vaccine. Can you tell us more about the work that you've been doing in this field?
Kiranji, I'm very happy you asked me this particular question. Actually, it is almost going to be 2 years. And in spite of the pandemic, when everything was actually closed, my entire team was absolutely active and were regularly visiting the slums, especially the women and children. That is our and we could feel what a massive amount of crisis they were actually dealing with. And that was the time when actually the first wave was not very strong. Still, there was so much of financial loss, there was so much of stress and everything that happened, as you know it already. And the second wave, things have become really bad. And that is something where we planned for our attending the food security first, and then attending the hygiene and other areas second, and third is of course taking care of the nutrition part, which is so essential for women and children. And of course the fourth one is now we are also concentrating on mental health counseling, which is a huge battle for all these women because they don't even know what stress they are undergoing. And these are the 4 areas we are attending currently in all our slums of Delhi and Gurgaon.
Now, which are these particular pockets that you go to in Delhi and Gurgaon?
Actually, when there was a total lockdown, we used to be in touch with them via virtually. And when government opened up, we started going to them. This is for the current situation. And the areas in Gurgaon and the sectors are 47, 57, 53. And in Delhi, you can say the Rangpuri area, the Nathupur area, the entire Mahipal belt.
Were these areas ever under the containment zone?
Yes, they were. And during the containment, we used to be in touch with them virtually as planned by us. But the moment it was open, we started our activities. So that was only for a period of 2 to 3 weeks, as suggested by the government.
Now, what I want to ask you is that when you work with this target group and you are working in such areas, how receptive are they to health education when you tell them to maintain COVID appropriate behavior? Now, even as we fear a third wave coming and we've seen so much of loss, we still see people roaming on the streets without masks, particularly their children roaming around playing. Now, how have you been able to reach out to them and educate them?
I'll give you a very interesting thing. What you said is true and also not true, meaning we see more women still wearing masks than men. And then we have been working with them for health and their entire women focused necessities for the last so many years. So we have a very good rapport, and in our communities particularly where we intervene, things have been much under control. Like our staff, they maintain all the guidelines by the government very rigidly, very strictly. And we make sure so that wherever we are going and reaching, they also follow the same guideline. Of course, they also want to run away and escape the masks and the distancing factor and try to be normal like all of us. We feel the same way, but yes, it is hard. But I would still give a lot of credit to women in general. Women are more responsive to mask wearing than men. I would say that all the time.
Apart from them suffering financially, there has been one other thing that has been of a lot of concern, and that is the children's education. All the schools have been shut since last year, and somehow the children who come from better off homes, who have access to their handheld devices like the laptop or the mobile or the tablet, have been able to attend online schooling. But these children have suffered the most most. They may not be having that mobile phone with them for online schooling. It's been more than a year since they've been loitering on the streets or probably sitting, with their parents at their stalls vending vegetables or fruits. What is your concern for these children? Have you been doing anything for them?
Exactly what you said have been our concern, Sukarya's concern for the last 1 year. And we have been trying to address to all our CSR partners or even donors or agencies who are keen to help us that these children are not coming from the regular academic background. They are not disciplined the way other students actually go from the kindergarten or nurseries. These are different children. They are brainy, they are talented, they are very enthusiastic. But the moment you will drop attending them, they are just helter-skelter all over everywhere. Actually, honestly, they do not succeed so well with virtual learning. It is tough for our staff, for my people, to actually teach them properly via phone and everything. But yet, the good news is they're still doing it. We are still able to gather them and make them attend the classes and do something better than nothing. And at least their parents are relieved that Sukarya is attending them regularly. It is a very big challenge. Whatever we had done so far and making them attending classes, togetherness in a disciplined manner to attend the curriculum, listen to it, learn it, and reproduce it, everything definitely have been affected very bad. But yet, I still always see the light at the end of the tunnel. The children are so good, they are still ready to function, at least in my areas. They are able to attend the online classes that my team is doing so regularly, routinely. They also feel baffled how to deal with it. Yet they are trying. We are all trying. And I'm very hopeful that if the parents at least will be vaccinated, and by the time, of course, vaccination comes for children, the education will be affected like other education. But we will be able to resume our classes, at least sending the buses to the slums the moment the vaccination at least comes to 40% to 50% level, so that there is some amount of safety and we will maintain the distance, and I'm very confident we'll be able to run the classes as before.
We fear that there'll be a third wave coming, which might affect the children very badly. And so it becomes imperative for us to get the children vaccinated. Have you managed to convince their mothers, the children, that it is important for them to get vaccinated?
The process of communication for vaccination or vaccination advocacy has been going on for the last 4 months. And the first phase, of course, as you know, that we have been able to convince them, and as you know, they are already taking the vaccinations. But as you know, there was not an regular availability of vaccination. There was a shortage and things definitely were little stalled, and it was postponed to 60 days or 80 days depending on the kind of vaccination, Covaxin or Covishield. But again, there are certain pockets where we work seriously. These ladies, they now know that vaccination is the only safety bet they have in hand. Our normal communication with them is, तुम्हें vaccination से क्यों डर लगता है? तुम्हें कैसे डरना चाहिए? That is the message the staff and the team has been giving them. For the third wave, yes, of course we know it. The third wave is actually already there in Maharashtra and few other states where children are being affected. Of course, there is a warning, and we have been telling them, as long as the government's more and more specific guidelines comes over, we will be immediately trying to do that.
What is your message to the people if they also want to reach out to the underprivileged groups?
First thing is, are you being sensitive or being sensible or being responsible to the underprivileged community or not? And I would say that everybody should feel a little more sensitive to donation. This is something which is a big challenge for all the non-profit world.
Well, let's hope you meet with success and together we make some contribution to helping the society in these troubled times.
Thank you so much.
You were listening to Kiran Mishra in conversation with Meera Satpathy from the NGO Sukarya. This broadcast came to you from All India Radio.